So swine flu is a form of an influenza virus. Many vertebrate animals have their own versions of influenzas. People have heard about bird flu. We obviously know about human flu. Well, guess what? Pigs get the flu too. And what's interesting is that pigs don't just get pig flus. Pigs are uniquely susceptible also to bird flus and to human flus. And in the case of swine flu, what we actually have is a hybrid virus. It's a virus that is mostly swine in origin, but it has both bird and human sequences in it as well. Influenza is typically spread in the form of small droplets, so that as we speak to each other, as we cough and sneeze, there are little droplets that go floating out of our respiratory tract. And these droplets will travel somewhere between 3 and 6 feet. And so if you're much beyond 6 feet of a person, the likelihood of catching flu from them is vanishingly small. But the other thing, of course, we do as people is we touch our noses, touch our eyes, touch our mouths, and then you've got virus on your hands. And so then I walk up and I shake your hand and then you touch your nose, so we can have both droplet transmission and then direct contact transmission. This virus, the swine flu virus, is actually an assemblage of other viruses that we've seen before. Part bird, part pig, and part human. And this is a common phenomenon. This happens almost continuously, and it's just every now and again we end up with a virus that has the ability to infect humans and to replicate in humans. Now the good news so far is that this virus doesn't seem in America to make people terribly ill. So what's being seen in Mexico seems to be drastically different from what we're seeing in the United States. They're reporting significant levels of mortality, severe disease, people with bad lung disease. And yet we've had now something in the neighborhood of 40 cases reported in the United States, and thus far it's behaving much more like the influenzas that you and I know, the one that comes around in the winter, what gets referred to as seasonal influenza. Now, things change in time, but so far the experiences that we've had in the United States suggest that this virus is no more virulent than what you and I are sort of used to dealing with every winter. Swine flu looks just like regular influenza, and in fact, in the vast majority of cases, I really don't care whether you've got swine flu or human flu because you're going to get better and you'll do just fine. The symptoms are the same: headache, fever, sore throat, cough, myalgias, that's sore muscles and sore joints, and especially common in children, abdominal pain and vomiting. Quite often children don't develop the degree of cough that adults do, but children will have a fever, runny nose, and may vomit. But otherwise, aside from the molecular biology, the swine flu is really indistinguishable from what's been circulating all winter. So there are a number of treatments. There are anti-flu virus drugs, Tamiflu, which is oseltamivir, and Relenza, which is zanamivir. And these are two drugs that will block the replication of the virus. Now, these are not drugs for everybody. These are drugs that really are best reserved for people who are either at risk of developing severe flu. For instance, if you had a patient with severe lung disease, perhaps asthma, severe heart disease, or somebody who was significantly immunocompromised, perhaps with HIV or cancer chemotherapy, then we could go ahead and use these drugs to prevent these people from getting any influenza were they exposed. And then if they get influenza, we can use these as treatment. But for the average person who gets influenza, Tylenol or Motrin, lots of fluid, chicken soup, and a little bit of TLC is really all that most people really need. Endemic.